Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, I am Safitri Ramadhani Noviana. For this meeting, I want to presentation. My topic today is the danger of drugs. If you have any question, I'll try to answer them afterwards. First, let me talk about the meaning of drugs. What is drugs? Drugs stands for narcotics, psychotropics, and illegal drugs, while the term NAPSA is narcotics, psychotropics, and other dangerous addictive substances. Narcotics can be only used for the benefit of health service and or the development of science and technology. Narcotics comes from the English narcotics, which means drugs. In the English language, narcotics. In Indonesian, narkotika. The meaning of narkotika or narcotics is drugs. Narcotics are substances or drugs derived from plants or non-plants, but synthetic and semi-synthetic, which can cause a decrease or change in consciousness, loss of pain, and can cause dependence. Law number 35 of 2009. The way narcotics work affects the nervous system, which can make us feel nothing, even if the part of our body is hurt. You can find a complete list of narcotics groups in Permanent Case number 41 of 2017. Broadly said, the types of narcotics are: first, papaver plants, raw opium, ripe opium, opium jichinko, medicinal opium, morphine, egonina, cocaine, cannabis plants, and cannabis resin. Second, salts and derivatives of morphine and cocaine. 3. Mixtures and preparation containing the above substances. So, that I want to talking for this section is the danger of drugs. There are: first, dehydration. The impact of drugs used on the human body can cause an electrolyte imbalance. As a result, the body will be dehydrated. If this effect continues, the body will experience convulsions, hallucinations, more aggressive behaviors, and a feeling of tightness in the chest. And the long-term effects of dehydration can cause damage to the brain. Second, hallucination. The impact of drug use on the human body, especially that which is often experienced by drug users, such as marijuana. Not only that, in excessive doses it can also cause vomiting, nausea, excessive fear, and anxiety disorder. If the use lasts a long time, it can continue to cause bad effects such as mental disorders, depression, and constant anxiety. Third, loss of consciousness. Users who use drugs in excessive doses, the effect makes the body to relax so that consciousness is drastically reduced. In some cases, the user sleeps continuously and does not wake up as a result of drug use on the human body. In fact, the loss of consciousness makes body coordination disturbed, often confused, and change in behavior occur. The impact of drugs that are quite high risk is memory loss, so it is difficult to recognize the surrounding environment. For cardiovascular disease, stimulants such as cocaine and methamphetamine can damage the heart and blood vessels. Long-term use of this drug can cause coronary artery disease, arrhythmias, and heart attacks. This also means the impact of drug use on the human body. 5. Breathing problems. Drugs that people inhale can damage the respiratory system and cause infections and chronic respiratory disease. Opioids slow a person's breathing by binding to specific receptors in the central nervous system that regulate breathing. By suppressing a person's breathing, this drug may cause slowly breathing, or heavy snore. A person may stop breathing completely if they take large doses of opioids or take them with other medical, such as sleep aids or alcohol. 6. Kidney damage. The kidney filter excess minerals and waste products from the blood. Heroin, ketamine, and synthetic cannabinoids can cause kidney damage or kidney failure. 7. Liver disease. Chronic drug and alcohol use can damage liver cells, causing inflammation, scarring, and even liver failure as drug as a use affects the human body. 8. Effects on the brain. Although early drug use may use may be use may be use may be voluntary, drugs have been shown to alter brain chemistry, which impairs an individual's ability to make decisions and can lead to compulsive craving, seeking, and use. This then becomes a substance dependence. All drug use, nicotine, cocaine, marijuana, and other affects the brain's reward circuits, which are part of the limbic system. Drugs hijack this reward system, causing unusually large amounts of dopamine to the flood to flood the system. It is this flood of dopamine that causes the high or euphoria associated with drugs abuse. Ninth, risk of infection disease. Drug use is linked to risky behaviors such as sharing needles and unsafe sex, and can also weaken the immune system. This combination greatly increases the chance of contracting HIV, hepatitis, and other infections disease. Drugs that are commonly injected and can cause HIV, hepatitis, and other infections disease: cocaine, heroin, methamphetamine, prescription opioids, steroids, appearance and performance enhancing drugs. 10. Hormonal effect. Appearance and performance enhancing drugs interfere with the normal production of hormones in the body, causing both reversible and irreversible change. These changes include infertility and testicular shrinkage in men, as well as body hair growth and male pattern baldness in women, according to the National Institute on Drug Abuse. 11. Prenatal effect. Studies show that various drugs can cause miscarriage, premature birth, low birth weight, and various behavioral and cognitive problems in children. And a baby can also be born dependent on the drug if the mother uses regularly, a condition called neonatal abstinence syndrome. Women who are pregnant, considering pregnancy, or are breastfed health care provider about the danger of various medications to an unborn or nursing baby. And 12. Death. The worst impact of the drug use on the human body occur if the user uses these drugs in the high doses or known as overdose. The use of methamphetamine, opium, and cocaine can cause convulsions in the body, and if left unchecked, can lead to the death. This is the fatal consequence that must be faced if you get addicted to narcotics. Your life is at stake. For example, we think about the American Addiction Center. There are many factors that can increase a person's risk for developing an addiction, including genetics, environment, biology, psychology, age of first use, addiction to the substance use, and frequency of substance use. That support may argue physiological risk factors may include the patterns, cognitive and affective distortion, control, distortion, temperament, impulse control, and other mental illness. However, the impact of drug use on the human body can be prevented even for addiction by involving all parties apart from being against religious teaching. Drug users can also be thrown into prison. Environmental risk factors may include family, culture, peer social support or lack of social support, trauma, stressor, toxins and substance availability or accessibility. Biological risk factors may include deficits in neurological from various causes and other physical illness. So, full treatment for drug like addiction, including counseling, drugs, or both. Research shows that combining medication with counseling gives most people the best chance to success. Here we can see the ranking of accidents that occur on the road from several causes, which is the highest. You can see that picture. And another interesting point are about the various kinds of drugs that are most often in Indonesia. First, cocaine, included in the type of drug that is highly addictive and can affect the central nervous system. The drug, which is made from the leaf extract of the coca plant, is in the form of a fire, white powder or crystal, and can be used by injection, snorting, or inhalation. Second, marijuana refers to the dried leaves, flower, stems, and seeds of the cannabis sativa plant. This type of drug, known as chimeng, is usually used by being smoked like cigarettes, put into food, or brewed as tea. 5. Ecstasy. 3. Ecstasy, synthetic drug derived from amphetamine, drugs known for their hallucinatory and stimulant effects. This type of drug is at high risk of being abused and can lead to dependence. And for heroin, this type of addictive drug comes from the opium poppy flower. Some drugs belonging to the class of heroin can be used as pain relievers in some medical cases. However, heroin is classified as an illegal drug because it has dangerous side effects. It's quickly absorbed into the brain and can make people so addicted that it is difficult to stop. 5. Methamphetamine, a type of stimulant drug that acts on the central nervous system and is highly addictive. This type of drug is included in the list of drugs that are most often abused in Indonesia. Shabu shabu is a white crystalline powder, odorless, and has a bitter taste. We've seen that avoid using drugs for many reasons and don't even use drugs as an escape from life's problems. Drugs may be able to calm feelings for a while, but after that, drugs will only increasingly damage and disrupt various aspects of the user's life. If you're already addicted and having trouble quitting on your own, remember that it's never too late to improve, so don't hesitate to ask the doctor for help and undergo drug rehabilitation.